The CBO is kind of like the umpire in Congress when it comes to budget matters. And whenever there's a big piece of legislation coming to the floor, everybody looks to the CBO report. How much will it cost? How much will it save? What are the potential impacts on society? And this is the latest of several CBO reports on the Republican health care bills that are advancing in Congress. And this one looks at the Senate bill. Basically, it seems like the bottom line is very similar to what CBO found on the House bill. One statistic that everybody's looking for is, what is the bottom line impact on the uninsured? And CBO says that, according to its estimate, under this bill there would be 22 million more uninsured people in about 10 years' time, the year 2026. Under the Obama law, the number of uninsured people has been going down steadily. It's now kind of plateaued or stalled, but under this legislation, it would start to rise again. And there's a dispute about how accurate are these numbers. Can they really say it's 22 or 23 or 24 million? There's a lot of back and forth about that, but you don't hear a lot of people arguing about the direction of the estimate, that it's going to lead to more uninsured people. The biggest impact of the legislation, and this is kind of getting into a somewhat touchy area among Republicans, the biggest impact is going to be on Medicaid. The biggest impact of spending reductions is going to be on Medicaid. Now that's the health care program, federal state program for low-income people. And under the Obama legislation, it's been expanded in 31 states to cover more low-income adults. And the Republican approach would phase down the generous federal financing that Obama provided for the expansion. And it would also take the whole Medicaid program and put a spending limit on the federal dollars going into it. This bill is not about people covered by employer plans, people buying their own health insurance. The changes in the Republican bills will probably lead to lower premiums for younger people, people who are in relatively good health, but for older people, it'll lead to higher premiums. And overall, across the board, the insurance that's envisioned is likely to cover less of your medical costs, so that deductibles and co-payments will probably be more. The analysis of the Senate bill is not that much different from the analysis of the House bill. But there's a lot of political will, there's a lot of determination to get this rollback or partial repeal of the Obama health care law passed. And so, you know, it's two forces on a collision course, and what the result is going to be, we don't yet know.